Okay, let's go for the second module, and it will be about pharmacokinetic parameters and their clinical use. And what we are going to discuss in this module, we will cover bioavailability, F and distribution, volume of distribution, metabolism and role of albumin in metabolism and affecting drug concentration, clearance, half-life, and clinical application of this parameter with case studies. Okay, regarding bioavailability, so if we have two dosage form from the same medication, we will have different bioavailability, which is the amount of drug that reaches circulation over time. Not only the amount, but over time. So as you can see here in the graph, the oral route, which is in light blue, the amount that reaches circulation over time is less than the IV route, which is in the clear area, and the bioavailability will equal to the area under curve, which is the concentration over time for the oral formulation, divided by the area under curve for the IV. So it is the fraction of the administered dose that reaches the systemic circulation in active form. And as we mentioned, F equal amount of drug in the circulation compared to the administered dose. So if we give a 500 milligram dose and 400 milligram only can be measured and reach in the circulation. So the amount in circulation divided by the administered dose, which is 400 divided by 500 equal 0.8 or 80%. So if we have the same dose like 100 milligram from the oral and 100 milligram from the IV, the F will equal AUC for oral divided by area under curve for the IV. But if we have different doses like 500 milligram from oral and 300 milligram for the IV, and in this case we will have the dose factor. We cannot rely on only AUC oral divided by IV because we have a different dose. So the formula will be the same AUC oral divided by AUC IV, and we will multiply by the dose IV divided by the dose oral. So we can use this formula in general, and we can put the dose IV 100 and 100 for the oral if the same dose is given, and we put different doses to be in general use. So for the route of administration, the IV injection is 100% because there is no absorption, which is the main factor affecting the bioavailability. And if value equal to 1, and for the oral, it will be variable and usually less than 100% because there is no oral medication have 100% absorption. And it is variable, may be high or low according to the formulation. For formulation like sublingual, rectal, and intramuscular, usually it is intermediate and depend on the formulation also. Most of the time, this formulation having area under curve or oral bioavailability more than the oral dosage form. Okay, let's have a working example on the bioavailability calculation. So determine the F value for a drug available as 100 milligram capsule with a calculated area under curve of 20 milligram per deciliter per hour when 100 milligram of the IV bolus of the same drug exhibit area under curve of 25 milligram by deciliter per hour. Because we mentioned it is the concentration over time, so milligram per deciliter per hour. So the area under curve here will be 20, which is the area under curve for the oral divided by 25, which is the area under curve for the IV, and we will get 0.8. Or we can multiply by the dose IV divided by dose oral, which is 100 divided by 100, and we will get the same value, which is 0.8. So to calculate the oral dose equivalent to IV dose. So if we have an IV dose and oral formulation, we need to give the same, we need the oral dose to reach the same amount of the IV dose into circulation. So the oral dose will equal to the desired IV dose divided by F. So we just rearrange the equation, which is F equal to the IV dose compared to the oral dose. So in this case, if the IV dose is 200 milligram and the F equal 2.5, mean the oral formulation reach circulation is half. So general and direct calculation, so half of this oral 200 milligram will reach circulation, so we need 400 milligram for the oral formulation to give the same effect of the IV dose. So the oral dose will be the 200 milligram of the IV divided by the 0.5. So we will get 400 milligram. So if we give 400 milligram for the oral dose or other dosage form, we will get the same effect of 200 milligram IV dose. Okay, to further explain the bioavailability, so a lot of factors will affect the bioavailability, and as we mentioned, most of these factors related to the absorption. So poor absorption from the GI tract because of the formulation or acidity or interaction. First, fast metabolism, as we mentioned, some of the drugs can reach first to the liver and have an extensive metabolic process. So the amount that reaches circulation will be less than other forms. Drug instability in the stomach. So some drugs are broken down in the stomach by acidic media, and interaction in the stomach with food and enzyme and other drugs like the calcium product and the aluminum antacid can interact with some component in the GI tract or the stomach, and the amount that can be absorbed will be less than expected. So the clinical significance of bioavailability we mentioned before is to determine the amount of non-IV dose reach the circulation. So if you use F factor, we can know how much the amount of non-IV dose to reach the circulation, and it will affect dosing because we need higher dosing for the oral dose compared to IV dose to compensate for the liver from the gut in the absorption phase and the liver from the first pass metabolism. And in general, the F value of 1 is 100% bioavailability, like the IV route. If less than 1, so some of the drug will be lost before reaching the circulation, and the use in dosing to adjust oral dose when F less than 1. So to reach a specific amount in the drug, we need to adjust according to the F value as we mentioned in the previous slide.